Good afternoon, everyone, and welcome to this, our fifth RBP live webinar. I'm Kate Perry, one of the partners at RBP Chartered Accountants, and we're a leading firm of medical specialists. And today we're going to discuss that dreaded CQC visit. I'm delighted to welcome today Rathai Thevananth. Rathai is a managing partner in a GP practice and also a primary care compliance consultant. And she does various work assisting our clients and other practices around London. Welcome, Rathai.
Thank you.
Just to let you know how the program's going to evolve today, we're going to have a chat about some things that you can do to prepare for your CQC visit. And we will end the session with a question and answer session when you'll be able to ask your own questions. And you'll see that on your screen you've got an icon. There is a live chat icon, but please ignore that. And just to ask your questions, use the live questions and answers icon, which is either at the top or bottom of your screen, depending on what device you're viewing this on. Now, I'm sure most of you watching today have already been through a CQC visit. But what we're here today is to try and improve on perhaps your rating or to help you maintain the rating that you've already achieved, as we're hearing that there are, due to changes in your practice, times when that may fall. So we want to avoid this at all costs. So you get that dreaded letter and it falls on your mat, and you know that you've got a very limited time to deal with the whole situation. So we know rather that the time that you're given for the inspection is very limited. What's the standard notice period these days?
The normal notice period is 2 weeks.
Just 2 weeks.
Yes.
To get completely prepared and ready for the inspection. So what are the first things a practice really needs to do in order to prepare for the visit?
Well, preparation is key. There's a lot you can do. One of the main things you can do is to make sure that you have all the documentation that the inspectors asked you to submit sent to them in a timely manner. So that could include things like your complaint summaries, your significant event analysis and action plans, any audit cycles, anything else that's important that's requested by the inspector, and you need to send this within the time frame, which is 5 days.
So you mean you've got, so within that 2 week time frame, you've actually got to send information before the visit. So you've only got 5 days to gather your information and send it off before the 2 weeks time for the period of the inspection. That's quite a tall order, isn't it? So now we've got some policies in place. What should they actually do for the actual day of the inspection?
So one of the things that you want to do is make sure that the team is prepared. You could have a mock inspection. You should make sure that all your staff know what they're doing as well as what others are doing. Make sure that you have all your policies and protocols updated, that they are easily accessible on the day and that everyone knows where they're located. At the same time, you want to make sure that you have got all the other documentation and evidence that's going to be required to show that you're delivering care safely, effectively, that you're being responsive and well-led and caring.
Okay, so how about, can we do some more preparation by looking at other people's reports, for instance?
It's always a good learning experience to look at other reports, such as those that have not done so well, rated as inadequate or requires improvement as well. At the same time, it's a good idea to look at those that are outstanding as well to see what you can learn.
That's great. So once we actually arrive at the day of the inspection, what do we really need to get ready, and who needs to be present for the day of the inspection, and what records should you really have available?
So the day will start when you're going to have to give a 30-minute presentation. During that presentation, it's a good opportunity to actually show the inspection team what you're doing really well, that you have addressed any concerns that might have been picked up previously in your previous report. It might also be a good idea to involve other members of the team and have your PPG there as well. It's also important to make sure that you have all your files in order, that they are accessible, that you've got your policies and protocols all updated, so that they're easily there for them to view. Also, you want to make sure that the day is going smoothly, that the organisation is well led, and show them what you're working on, that you're aware of where your weaknesses are, and that you're actually having action plans put in place.
So you can then sort of tell them that perhaps you have a weakness in a certain area, but presumably once you've done that, you really want to say what you're doing to improve on that weakness and what actions you've taken to organise that.
Yes.
And that's okay, that they will sort of be happy with that.
Yeah, it's important to have an action plan in place, but very important to actually understand where your areas of improvement are.
That's great. So from your experience, what sort of things have you come across that are sort of common shortcomings that you find that practices regularly seem to not be able to deal with adequately? Maybe things that people perhaps haven't even considered and completely forget about, but that the CQC perhaps do focus on.
It's important to look at your previous report and look at any of those recommendations that were made and any shortcomings that were there, that you have addressed them since the last inspection. It's also important to ensure that your staff are adequately trained to their roles, and also that you have all your recruitment files in place, that there are sometimes practices that will have staff that don't have DBS checks in place, or they may not have a DBS risk assessment in the absence of a DBS. You will have to also look at your clinical system, make sure that there are no gaps there and that the workflow is running smoothly, that there are letters that are being actioned, that the pathology is being actioned, that audits are carried out as well, and that risk assessments are being done, but also that action plans for those risk assessments are being completed and not just left.
Yes, I mean, one thing I was thinking, I suppose you need to make sure you haven't written a policy that you forgot you wrote and actually aren't following.
Yeah.
So I'm sure that's something that some people do, particularly if you're copying things from elsewhere and you haven't properly processed it in your own mind.
Yeah, it's important to actually make sure that what you're saying in your policy is what's actually happening in practice as well.
Yes. So having gone through the day then, and hopefully you've found all your policies and everything you've been requested, what happens at the sort of end of the day, at the end of the visit? And how long does the actual day, so will it start at 9 o'clock and finish at 5? Is that the sort of time?
Yeah, it can start from any time between 8:30 and 9 o'clock, and it finishes usually 5 o'clock, maybe later, maybe earlier, depending on how well organised the practice is and how quickly the evidence is gathered. It all depends on how well you're prepared.
So do they hold a meeting at the end? And if they do hold a meeting, who needs to attend that meeting?
So there is a feedback session at the end. It's a meeting whereby the team for the practice meets the inspection team as well, and their initial thoughts are shared about the day and about the findings from that day. Remember though, the final thoughts are they're not going to give you a rating at that point, no, obviously, but it is just the initial findings.
Great. So, okay, so we've managed to get through the day, and obviously they're going to the inspectors are going to go away and write their report. So obviously they'll write their report and send that to you. So is this document easy to interpret? Is it always very clear how to understand what it is they're asking you to do, or the areas where you're not actually doing very well? Because I can imagine that sometimes it may not be that clear.
It's a report that you have to read. Make sure that you read it and send it as soon as you can. in the specific time frame. The reason they're sending this to you is for you to check factual accuracy and also completeness of the information that's been gathered. If you have any concerns or you're not sure about anything, it's always a good idea to speak to the inspector about that. And the report is normally published within 50 days.
50 days. So we need to make sure that they haven't put something in the report that's actually inaccurate. For instance, they say you haven't got some sort of report or policy, and you read it and you say, well, actually, we have got this policy, and for some reason on the day it wasn't provided, or it couldn't be discovered on the day. So you need to get back to them, presumably pretty quickly,
Yes.
to make sure that they amend this report before it gets formally. So it gets formally published on the CQC website.
Yes.
Once you've accepted. So do you have to sign to say that you've, and send it back and say that you've accepted it?
Yes, so you do want to make sure that you have acknowledged that draft and you have corrected any factual inaccuracies within that specified time frame. That's your opportunity to do that.
Okay. So that's the visit then, but presumably for CQC, you need to be doing things throughout the year to ensure that you, when you next get your visit, you're actually really very well prepared and all your policies and everything's in place. So what do you think needs to be prepared sort of on an ongoing basis throughout the year? Because I can imagine, although you're waiting for this dreaded letter, things can be left and you think, well, I'll deal with that at some point. But this needs to be an ongoing process, doesn't it?
Yeah, I mean, you never stop preparing for an inspection. You want to make sure that your systems are actually embedded in the practice, that everyone knows what's happening in the practice. Make sure that training and development of your staff continues and that the mandatory training gets completed as well. Make sure that you are looking at any areas of improvement that come up. It could be through complaints, NHS choices, as well as your patient survey. So you want to have an active practice log, if you like, maintain that and make sure that you're updating your policies and that it's reflecting practice, best practice as well.
Right. Okay, so everyone now, I think every practice in the country has had at least one CQC inspection. Quite a few, I assume, presumably the inadequate ones. I know some of my clients have had inspections fairly quickly after their first inspection, and presumably that's because they had poor ratings in certain areas and they need to be followed up quickly. But every practice has now had an inspection, haven't they? And I understand now that for those who got a good or even better rating, they're getting a telephone inspection where the inspectors don't actually visit the practice, but that they have a telephone call. So can you explain, because I'm sure only a few have had this now, can you explain what this means and what our clients need to do to prepare for a telephone?
So since April 2019, new changes have come in force whereby those practices that were rated good and outstanding will receive an annual regulatory review, or ARR. So that's a call. The inspector, you have to provide any information. It's 22 questions long, and the interview on the phone lasts between 1 hour and 3 hours with the inspector.
Right.
You want to be able to provide that information because what that will do is give the inspector an idea of if there's any improvements that have been made to the practice or if there's any kind of failings or areas that need to be improved as well, can be seen from this. So preparation is key.
So should you perhaps in your responses refer to your report, and where there are poor ratings, try and ensure that you've clarified the fact that you've taken action points and you've tried to improve?
Yeah, it's important to actually be able to identify what those areas of improvement are, show an awareness. You could be looking at things like your immunisation uptakes, your performance, your patient survey, any sort of performance indicators. So if you're aware of what what your data is, it's important to also show an understanding and also what you're doing about it. So an action plan really, which you can talk through the inspector with.
Right. But this preparation you're doing, you don't send anything before the call, do you? This is just you preparing, so you answer the questions during the call.
Yes.
You don't prepare anything and send anything off like you would for a full inspection.
You will receive the questionnaire 4 weeks prior to the call.
Okay.
And then it's your opportunity to make sure you have all the evidence there in front of you during that telephone call. The call itself is not an inspection, but it is an information gathering call.
Right. And presumably if anything comes out of that telephone call, that could perhaps trigger an actual visit if they're not happy with some of your responses.
Yes, it could mean that they're going to focus on certain areas that you've drawn their attention to, or where there's more variance, or it could indeed mean that you're just going to have a full inspection.
Okay. So talking about these re-inspections, which we're now on, what are the periods, the sort of time gaps between inspections, or can it vary?
So for those that are rated inadequate, the inspections occur every 6 months. For those that requires improvement, it will be 12 months. But those that are rated rated as good or outstanding, they will be inspected at least once every 5 years.
Okay, so that feels more bearable. So everyone should try and achieve a good rating, obviously.
Yes.
So we've probably covered most of the things to do with CQC, so continuing system throughout the year, the actual visit, if you have a telephone visit, what you need to do for the telephone visit or telephone call. So what would you say are the main points that our clients really ought to take away from today's webinar?
So if you have had that call from the inspector, preparation should start now. Don't wait. Make sure that you are looking at an action plan for your practice to get everything in order. Put systems in place if you haven't already to make sure training is being done at the right times. Make sure that you're holding meetings with your staff, that you're updating your staff, that everyone knows what's happening and everyone knows what they're doing in order to be prepared for the day. Communication is important, so everyone knows what you are also doing as well. Clear leadership and good leadership is important.
So from what you're saying, we need to make sure we involve every single member of the practice in this, yes, so that everyone knows where everything is held and how everything should be run in the practice.
Yes. Absolutely. It's important for everyone to know what they're doing because they will all be interviewed at the time of the inspection. So it's good to make sure that they are prepared, that they have an understanding of the policies, of procedures that are happening in the practice as well.
Okay. Well, I think we've probably covered most of the main points now. Is there anything you can think of that perhaps we haven't really covered? Obviously, we're hoping to get some questions. I'm not sure that we've got any at the moment. There was one I know that one of my clients had asked was about CPR training for, obviously your medical staff need to have CPR training, but I understand under CQC you actually need all your non-medical staff to have some training. So what are the rules and regulations surrounding that?
Well, as a practice, you need to make sure that all your staff have had their mandatory training. BLS or basic life support or CPR is an annual training requirement for clinicians. The CQC cannot tell you how often you need to train your staff, and that's up to you to make sure that you're assured that your staff are trained adequately to deal with such scenarios and making sure that they know where the equipment is located and that they're able to use that. But that is considered a mandatory training.
And you would get an external, would most practices get an external person to come in and do that training?
You can either do that. Training is widely available online as well as face-to-face training. You need to assure yourself what is best suited for your practice team.
Okay, so actually so we are now going to start the question and answer session. You can see at the top or bottom of your screen, you've got a question and answer icon. So if any of you who have been listening, if we haven't covered any points already, or you've got maybe a specific point that's come up within your practice, then please do go online and type in your questions. So just to remember, do use the question and answer icon and ignore the live chat icon, because we won't be able to read your questions if you use that. So I think we've now got a question through. So let me see what this is. Is there a clear list of the documents and policies that the CQC would expect the practice to have? Because a guide would be helpful.
The CQC doesn't provide the list of policies that you should have. A useful site to go to would be the Nigel's Mythbusters, if you Google, and they have various...
Sorry, is that a name, Nigel Smith?
Nigel's Mythbusters.
Okay.
It's a good idea to check that on a monthly basis for any updates. But ideally, there are many sites that now have lists of recommended practices and procedures. Each practice is unique, so there are common policies to most practices, but there are some procedures that may not be happening in all practices, so it is unique to you.
And have there been any significant changes in the regulations? So since, say, somebody had their first visit, has anything new come up that they need to be considering that's changed since in the last year or so, that is a new policy or something that they need to do?
If they're delivering, for example, minor surgery, they may want to make sure that they have a policy for that or a protocol for that. It really depends on what services you're delivering.
So you need to make sure that if you're delivering a new service, for instance, that you've covered the CQC element of that new service.
Yes, you want to make sure that you have a protocol or policy in line that reflects what you're delivering.
Okay, we've got another question in. All of the staff at the practice had training in sepsis, but what I was not aware of was that all locums had to have this training too. And this also included fire training. So I assume everyone has their fire drill. It was also brought to their attention that they needed locum appraisals. Have you come across this, and is this correct?
So it's ideal to have, everyone should have fire training. It's not something, again, the CQC cannot tell you what you should or should not have. However, as an employer, your liability is to make sure that you have trained people adequately. So in a case of fire, you would know how to know about the procedure, etc. That should be really in an induction folder for the locums as well as training. Sepsis, yes, it's a training that we are looking at, that is widely out there, that is a common problem. So you do want to make sure that people are aware of the signs and symptoms of sepsis. So it's important for clinicians as well as non-clinicians to be able to identify that. With regards to the appraisals, the CQC obviously are not going to look at the actual appraisal document, but we would like to have assurance that the practice knows when their GPs have had their appraisals. So it's a good idea to make sure that you log the dates of those appraisals.
So when we talk about locums, I mean, surely you're not going to appraise a locum that you have on an ad hoc basis to cover sickness or something. Are we talking more about the longer term, say a 6-month maternity locum who's actually within the practice for quite a long time? Because it doesn't seem quite right that you should be giving all your locums, a full appraisal system, because that means they'll be getting an appraisal at all the different practices that they work at.
No, I think it's important to understand that your doctors that you are hiring or asking to see patients have some sort of peer reviews, that they're keeping up to date with their NICE guidelines, that they are looking at their work and self-reflection. So all GPs should be having their appraisals anyway. So it's just to make sure that maybe it could be a standard question that you ask before you take a GP on, or before you take a locum on. It could be part of the induction pack.
So you'd be reasonable to ask for them to provide documentation to prove that they're keeping up to date with everything and they've had their appraisals. And
yes, if they're long-term locums, I think it's in the practice's interest to make sure that their GPs that they have working there their files are adequately maintained.
Okay. I don't know if there's anyone else out there who's got any questions. We don't seem to have any more coming up at the moment, so please get typing if you do want to ask a specific question. Rathai is here to answer any questions you might have. But in the meantime, do you have any sort of top tips, if you like, that we can discuss now?
So yeah, I can just throw some top tips out there while we're waiting for some questions. That would be great. One of the things that we could be doing is just to prepare your staff and making sure that they're put at ease. You might want to have a little quiz to make sure that they understand certain questions that might be asked of them with regards to their job role and policies and procedures of the practice. It's also a really good idea to maybe ask a colleague or a buddy practice to come in, because often they'll have fresh eyes to come in and have a look at your practice, how it's running. If there's anything that they could suggest to improve, maybe a different perspective is often useful as well.
Okay, we have actually got another question in, and this is, what is the time frame for the mandatory trainings? So how often do they have to repeat things like the CPR training and that sort of thing? Is there standard requirements?
The CQC, again, don't tell a practice the timeframes with which you're going to have your mandatory training. That's actually at the up to the practice. Nigel Smith-Busters is really useful to look at that one. I think that's Nigel Smith-Busters, if I can tell you the number. It's useful to look at Nigel Smith-Busters on a monthly basis.
So who are they? Are they CQC specialists?
Yes, Nigel is. Yes, he does he's a doctor that does a lot of myth. He kind of dispels a lot of the myths around some of the things that you come up with during inspections. But it really is, as an employer, the mandatory training is also at the discretion of the practice. It's how you justify that you're assured. So different trainings has got different timeframes. You might want to, safeguarding, for example, in my practice, we do every 3 years. BLS or CPR, I personally, in my practice, again, I will do on an annual basis, because I want to make sure that my staff don't forget how to, react in those kind of emergency situations. So I am assured as a manager that my staff are equipped and well trained. And it's also best practice, so you can look at the resus guidelines and things for that sort of thing. It does vary. Different training has different timescales, really, but it's about assuring yourself as a practice that your staff understand what to do in those given scenarios.
Right. And what about new staff? So you say every 3 years, but if somebody joined a year after you'd had some training, they've got a 2-year gap. Do you need to be concerned about that, or is the 3-year training for everyone still, so they won't have had that sort of training? What can you do about sort of new members of staff?
So it's important, as continuing professional development, for each staff member to have their own training schedule, if you like. So just because they've joined a practice later doesn't mean that they've missed out on the training. It's your responsibility as a practice to make sure that that staff is equipped to be able to manage. So training should be delivered for all. It doesn't matter if they're new or old, they should be keeping updated, but making sure that there's a training schedule in place as well. So there are planned dates for this.
Right. We have another question. What evidence were they asked to see for GDPR compliance?
So you want to make sure that you have all your GDPR policies in place. And in fact, you want to see that these policies are actually being carried out as well in practice. So it may be that your medical records person is actually following GDPR guidelines and working towards policy. So it's more about practice as well. So having the policy alone may not be enough. You might want to check that you've got the privacy statements in your employees' files, for example, making sure that you've got the GDPR posters up, that everyone understands what you're doing as a practice. It could also be relevant when it comes to sharing records and sending over solicitor requests for medical records as well. So making sure that you're actually following policy protocol, that you're actually acting. What the policy says is what you're doing is important when it comes to GDPR.
Talking about that, I know some of my clients offer their patients access, but I know you've got to be very careful with that, redact information about maybe other members of the family or other named people that may be on the notes. And I know there's programs, I think, that will offer this facility. I know some of my clients are really uncomfortable about using these programs because they're not necessarily very good at redacting appropriately. So do you have any advice about those systems? And as far as you're aware, does the CQC sort of accept that these programs are adequate, if you like?
In my experience, we've not actually looked at the actual functionality of such programs. What we are looking is that the staff that are dealing with these sorts of requests are adequately trained and have an understanding about confidentiality, and that information should only be shared, obviously with patients' consent, but at the same time that only necessary information is also shared as well. So it's more about the understanding. With regards to redacting, it's important that you have oversight of such programs, making sure that they are doing what they're meant to be doing. It's really checking those functions and making sure that you have oversight before you send off these records or
so the practice needs to be happy in themselves that they feel it's working appropriately, and not use it if they feel it's not appropriate for their circumstances. I've got another couple of questions here. So staying on the subject of GDPR, what changes should be made to the staff contracts in respect of the GDPR?
I'm not aware that you have to actually make any changes to staff contracts. Again, this is not something that the CQC are actually looking at in my experience of inspections. However, you want to make sure that you are following your GDPR policy and guidelines, and that you are acting within protocol. It's important to also make sure that your employees are signing a document, a privacy statement, that you are keeping their information confidential and safe. So just again, it's all acting within protocol.
Yeah. So again, still along the same lines, someone's asked where they can get confidentiality training.
There could be, there are some, this training is available on online sites as well. There are lots of online training tools out there. And also some of the links to practice manager sites as well will also have this training available.
Okay, so I don't know if you had any more tips. We're out of questions at the moment. Anything else you feel that could be useful?
One of the things that's important is that I find that practices often don't always complete is when they've carried out risk assessments. It could be health and safety risk assessments, it could be an infection control risk assessment, could be a fire risk assessment, and often the risk assessments are done by maybe companies, and then an action plan is there and presented to you. But what's important is that the practice does pick up on those action plans and actually do complete these action plans, because that again, it shows that you're actually being proactive and you're not just leaving it. It's important to manage those situations and keep an eye on your action plans as well, to show effective, well-led systems that are in place as well. It's also good to make sure you delegate tasks in the preparation for your CQC inspections. Don't put everything on your head as a practice manager. Make sure that you share the responsibility, but at the same time make sure that everyone's aware of what you're doing as well, and that everyone else knows why they're doing some of those delegated tasks as well.
Right. We've just got one last question. I think we'll make this the last question. Oh, I don't know if you're going to be able to answer this one. It's asking what is the most common thing, although I suppose it's very different in all practices, that you've come across. I don't know what experience you get when you've been to help with practices get prepared for their CQC visit, but from their past reports, perhaps you can have an idea. What is the most common thing that they might fail on in a CQC visit, or is it many and varied, and as you were saying, practices are all different, so one practice might fail in one area and strong in another area, but another practice might be completely the other way around?
It is actually not one single thing stands out to mind. It is many and varied, unfortunately. It's small things. It could be training gaps. It could be not maintaining those recruitment files. It could also be maybe clinical systems not being looked at in depth. Maybe it could be drug monitoring is one of the more recent things I find, where clinicians are issuing medication, but the blood results are not always on the system, so there's no sort of systematic review or process. So that again is quite an important one. Again, workflow and making sure that the letters are cleared in a timely manner, as well as pathology. It's just making sure that systems are actually embedded, because often one can affect another. So it kind of, you need to make sure that the practice knows what's happening, that systems are and processes are actually flowing adequately.
Okay, well, I think that will wrap that up for today. So thank you, Rathai, for coming. I hope those viewing who've been able to catch us live have found this a useful and informative session. Rathai is available to assist you if you have a CQC visit coming up. So please contact Emma at our offices if you want to get in touch with her. So I think we'll close that for today. So thank you very much, Rathai, for joining us, and goodbye to everyone.
Thank you.